Let's see what Ben's up to, because rumor has it Ben's still treating patients. 9:30 and he's still treating patients. Ben,
Someone's got to do work around
are you still working at this hour?
Yeah. Someone's got to do
Oh
something.
my gosh! All right, what are you doing?
So I have my beautiful patient here. We're doing some PDO threads. Here, come in. Let me show you.
You're gonna use my Instagram. Okay.
Well, yeah, we're gonna use your Insta. So look, check this out. This is somebody that the threads can really be powerful. She's got beautiful skin. She's young. She's already got a nice jawline, so you can improve it just that little bit more. So look, this is one that we contaminated earlier. So I'm just showing you guys. The thread will sit in her cheek, right about like this. You can put a couple here, and it really helps build that kind of rigid look along the jawline. So we talked about that overfilled mid face.
Yeah.
I think there's a role for the threads there. So go ahead, Yona.
Okay, so she's so pretty and she has
She's
nice
already
thick
pretty.
skin. Yeah.
It's easy to make pretty people pretty. Those are, we're blessed in that way. So I already numbed her a little bit.
Okay.
With 1% lighter Debbie. This is a 20 gauge needle, so she won't feel that go in. This is the 19 gauge PDO. It's actually a PDO Max Threads.
I actually like 19 gauges also. I've been using them in the jawline lately.
Yeah, 19 times 100. It's perfect. And so it's a great treatment for young people's nasolabial fold because, it's the best treatment of the fold, in my opinion, is to open it a little bit, right?
Yeah.
To do this, you allow opening and you create this kind of a rigid pillar along her zygoma. So when I numb her a little bit, I push it in, kind of pop through the dermal subcutaneous junction with that derm talk.
Okay.
Yep. And then you can feel sliding in right there. Right when I hit that convexity of the cheek, that's where I stop. I'll pinch it down with my left hand, hold it there.
So you don't go very far.
No, I stop there. If you go past the convexity, you'll see it. And then this is what I do. She knows because I've done this to her before. You pull really hard here. And it feels like you're closing a Ziploc bag. I can go click, 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 click.
Are there little traps on that?
Yeah, there's
feature?
bi-directional threads in here.
Oh, wonderful.
So it'll tighten even a little more with time. So I'll do the same thing along her jawline.
Great.
Wow.
And how long are you telling people that this lasts?
She'll get the volume for a good 6 months. It's PDO. It's like sculpture,
Yeah.
The lift, you're looking more like 3 to 4 months, I would say.
Okay.
So then sometimes they get a little bump there, and you just pop it in.
So can we see the lift? Can you show it? Can you show her cheek?
And can
Here.
we get closer
Yeah,
to kind of look straight?
Yeah, well, you can see it already. That's
So
pretty
and then
cool.
I'll do another one here. I'll also do them up the ramus sometimes, because as we know, it's that L that people are after. We're doing a little neurotoxin in her masseter as well today. So even though 20, so same thing. It's kind of the ergonomics of this. So the other side's actually easier for me, but I numbed her a little bit. You kind of make sure you're into that subcutaneous.
So you're at the earlobe is where you make your port?
Yeah, I make it just because, they can get a little hyperpigmentation depending on your needle size. This is a 20 gauge needle, so you're kind of safe. Let's see if we can find that. She's not even oozing on me.
Even oozing, yeah. She's got such
The hardest part is always finding the hole.
Mm-hmm. I don't even want to know about that.
you know,
I don't even
I think it's
understand. It's like out of control here, what I'm dealing with. And so
Trouble here. Even that needle.
maybe a little.
Yeah, maybe a little bigger poke.
So, but you can, and this is a 19 gauge thread, so it's a 20 gauge needle. You could use an 18 gauge thread, but again, they can get a little
Maybe she can
hyperpigmentation. Hold on a
hold
second.
the earlobe up for you too.
There you go. Okay, so same thing. Now, this is the part where I got to kind of pop in so she can feel me push. Yep. And once I pop in, I'm safe. So
You're immediately subdermal.
I'm
here.
subdermal. So, she's so thin that you can get a little deep. If you get into the masseter, if you scrape it, they'll feel you. And then in her,
So you're on the smash. Where are you
I'm just superficial with the smash.
You're
It's like-
superficial to the
and I
smash.
go to the posterior aspect of the kind of jowl if they had it. I don't go much further than this in people. So again, pinch there, pull back, and then
So you stop at the antagonial notch essentially.
I go a little past it, yeah.
Okay.
Depending on the on the skin. So she's got medium thickness skin. And then again, when you do this, you can feel like it's like closing a Ziploc bag. It's like click, click, click. I can feel little clicks.
Very
And then,
impressive.
Yeah, you can see a little. In some patients, depending on their skin laxity, you'll see the wrinkles back here that you've created.
All right.
The tightness.
Very cool. PDO threads.
PDO threads. These are PDO Max.
All right.
Actually, yeah.
Sabrina, let's go get after
Thank
hours.
you.
That's
And
all
let's
right.
take a look at her.
Enjoy.
Let's take a
Don't
quick
drink too
follow-up
much,
look.
guys.
So we get close.
We gotta get up at 4:30 in the morning to go to Miami.
Yeah.
But you are.
I'm gonna work
So
tomorrow.
she gets that
again.
nice. If we just get straight on her, look at how that left side. It just it picks up,
Right
you know?
away.
Yeah.
And that's 2 threads. I mean, you could do more, but more is not always better with these, in my opinion.
Yeah.
Honestly. It's
So
about where you
more
place
is
it.
not always
I
better.
always thought more was better.
Okay, good job.
Yeah.
Thank you to all who joined our first episode of Thriving in Diversity.
Thriving in diversity. Yep. From the U.S. So I thought that went pretty good.
Yeah, and Rockin' Rada is back. Hi, love. I know you were there today. I thought it was really good. Wendy and Val were so wonderful and gave us their kind of unique, outlook and their experience as an oculoplastic surgeon as well as a dermatologist practicing on the East Coast.
So does it make you appreciate the different skin types? Like, do you think there's a big difference in the way we treat patients of different skin types?
I've always been sensitive to different skin colors just because I have to be, especially if I'm applying laser energy.
Yeah.
And I'm sensitive to all of them because even, a Fitzpatrick 3 can absolutely PIH on you.
Yeah.
Or, end up having a more robust reaction to something like an IPL.
Yeah.
But what I'm even more sensitive because of this episode is the skeletal changes that vary depending on one's ethnicity. And there was a super interesting study, we didn't even cover it really, looking at South Korean beauty pageant queens compared to Paraguayan from South America beauty pageant queens.
Right.
And it was just interesting.
So the Paraguay patients, what they looked at was Miss Paraguay and Miss Korea.
Miss South Korea.
Yeah, and they looked at 54 Koreans and 54 Paraguayans and 34 Koreans, and they measured their face and they measured their anatomical features of the face. And what they show that women who were considered more beautiful in Paraguay versus Korea were a little bit different. Mm-hmm. The Korean faces were
We're
thinner
actually longer.
and longer.
Yeah.
And the Paraguayan faces were wider.
We're wider, yep.
And they had bigger lips, more full lips.
Hi,
But
Paul. Paul
it
Friedman's on.
Oh, cool. So the interesting thing is that that there's different standards based on different parts of the world, right? And we can't all live by one beauty standard, by one measurement. It's not mathematical.
So and actually they used the golden ratio, and the only real time that it applied significantly was around the mouth.
One patient only.
Yeah, I mean,
of all of them.
Of all of them. So when we're using and applying and we're measuring people with these calipers and applying the golden ratio, we might not be doing necessarily what is considered most preferred aesthetically in a particular region.
So we have to be sensitive to different ethnicities. But you know what's interesting? I have a lot of patients who come to me who want their noses fixed. And if they come, you're going to find this interesting. If they come from overseas and they moved here, so they were actually born overseas, they come here, they say, Dr. Dayan, I want a nose, but I want a really thin nose that's turned up and really small. But if they were actually first generation or second generation, so their parents were born elsewhere, they came here, they say, I want an ethnic nose. I want my ethnicity back. I don't want a tiny little nose like a Caucasian person. So I've noticed that there's a cultural component to it, and one that has to do with also the way they've grown up in society and where their position is in society at that time.
Yeah, so it's interesting. But anyway, I'd love to hear from you all. What are, for those that are practicing, are there anything, any considerations that you place in skin of color? I mean, technically we all have some degree of color to our skin, so I'd probably say more melanated skin types, like the classic Fitzpatrick skin types 4, 5s, and 6s. And are there other considerations, even when you inject those faces, that you're a little bit more mindful of in order to respect the skeletal changes that they naturally have based on their ethnicity? Doctora Angela is here. I don't know if any of you guys, no one is saying anything.
Maybe because we're just all kind of figuring this out at the same time.
Yeah, so...
And that's why we're doing Thriving Diversity. I mean, we'll be in Colombia. We're going to see how they treat people in Colombia.
Yeah, I mean, we've learned so much. I mean, think of how we're, the butt is in. I mean, people are...
The butt is in.
Butt is in. People are doing all kinds of stuff. They're
especially
infusing,
in South America.
But we learned and took a lot of this trend from South America,
yes,
from
sure.
Brazil and from Colombia. In fact, when you look at a lot of the BBL surgeons, many people were going to Colombia and Brazil to get these procedures done initially when they were not popularized here in the United States. And then also a lot of the literature has come with PLLA, at least, on the buttock from Brazil. So a lot of this has stemmed from our South American colleagues. And so we're actually going to take you all there live with us so that you can kind of learn what they were doing well before it was a trend here in the United States.
So there's a study actually out of Europe that looks at different butt sizes, and they asked doctors and plastic surgeons from all around the world what butt size they like best, and they asked doctors and they asked patients from South America, from Asia, from Europe, from North America, and guess which culture liked the biggest butts?
Moroccans? You don't see as a Moroccan. I mean, I'm just saying.
Maybe the Moroccans, but the South Americans like the biggest butts.
There you go.
They
So
like
there is,
big butts there.
They like big butts and
Big breasts.
big breasts.
They like the biggest breasts. Yeah, it's surprisingly because when you go down there, you don't see much.
Go
of the breast
big or go
hog.
home.
That's why you're
Bigger
with me.
is better.
That's right.
But so that is
Yeah.
interesting. Now, a question about that is, do they prefer it because that's what their visual adaptation has allowed them to prefer? So we know there was a study that Kate Goldie and I did where we exposed people to small lips, and we exposed them to small lips for 2 consecutive minutes. And after 2 consecutive minutes, for 30 seconds, and after just 30 seconds of exposing them to small lips, they preferred small lips for up to 2 hours. And then we exposed the same people to big lips. And those same people that preferred small lips once upon a time now preferred big lips after being exposed for just 30 seconds.
So we get used to what we're seeing, and we tend to like that.
Right.
So if you hang around with someone with big lips, eventually you start liking big lips. So your lips are looking kind of big tonight.
So,
I think
ladies,
yeah.
if you
I
want
like
him to
lips.
pay attention, then I guess you have to blow up your lips. I have no idea. But Nurse Tanya says that she likes big butts and she cannot lie. I guess she's like you.
Cannot lie. Nope.
But it's interesting. So there's definitely, and this plays into, what your visual diet is on social media.
Yeah.
If you're constantly, ingesting and digesting images of big lips, big butts, fake looking faces, then you are going to start preferring that, whether you believe it or like it or not. And in our study, the exposures were just 30 seconds. Can you imagine if you're on social media and you're on your phone for 2 hours, 4 hours, 5 hours, then your aesthetic preference might last much longer than just 2 hours.
Like weeks?
Like months.
Years?
I don't know. I'm in trouble. What are you watching on social media? So it is interesting the things that end up governing our aesthetic preferences.
Yeah, we're easily influenced by what we see.
Yeah.
Especially if we watch too much of it.
So then does that mean that plastic surgeons end up preferring things that look more done or more fake?
I think there's you've written about this a lot, perception bias.
Yeah.
And I think we have an aesthetic bias, and if we spend too much time around people who look like they're altered or unnatural, we start to not recognize what unnatural is. And I think if you go to a plastic surgeon, you look at his office or her office, and if them themselves and their staff look strange, then you're likely going to look strange because they will make someone look like they like and they prefer. So we tend to paint what we want.
How many of you agree with that? Drop some hearts if you agree.
Yeah.
I prefer handsome Moroccans. Ooh, Jeremy Green. So Jeremy just had a bambina.
Cameron.
Or Cameron.
Right? No,
a bambino?
His baby's name is Cameron, I believe.
You had a boy, Jeremy? I thought you had a girl.
I thought it was a boy.
A girl? Jeremy, tell us. What did we have?
Congratulations.
I'm a Tia. Hi, doctors. Oh, hi, Aaron.
Oh, look at
Alex. Alex is here.
In Madison probably now.
Hi, Alex. I hope your drive was good. Yeah, Jeremy
Yes.
had a baby. Yes, boy, girl. Oh, love you, Aaron. You're so sweet. Boy! Oh, my God. Jeremy, congrats. So much fun. Aw.
Hi, Al. My daughter's at Madison. She just got there. Year 3, going to be a junior at Madison. Wow.
Jeffrey is saying congrats, Jeremy. Wonderful.
So how many of you are going to be in Miami tomorrow, this weekend? We're going to Miami tomorrow.
I know.
Miami Cosmetic Surgery. That's going to keep us busy.
I'm going.
I know.
You're going? Good. So we have a flight at 6 a.m.
Yes, this is the life that I lead with this guy.